Okay, let's talk about prolotherapy. I get a lot of questions about prolotherapy. What is that? How do you use it? What happens with that? Prolotherapy is really interesting, actually. It's been around for a long time. It's not been prevalent in the medical profession, but it's been around since about the 1920s, actually. Obviously, it's progressed since then. We're not using 1920s philosophy about this, but ultimately, prolotherapy has made its name, and where I learned about it 20 years ago is with athletes. It's used in musculoskeletal injuries, but it's actually grown since then to be used in lots of pain problems. And I use it for that a lot of times. So whether it's a patient who has, they have a nerve compression syndrome, let's just take like carpal tunnel syndrome because that's a very common one to experience. It can be used for that. The term for that is actually called neural hydrodissection. There's not going to be a quiz, but that's what it's called. And ultimately what you're using is, it's a philosophy about what you're injecting a patient with. And if you're looking at like doing a knee injection versus a nerve injection, actually there's a lot of similarities between them. And frankly, it becomes down to the fact that mostly there's always pain that goes into that part. So we're looking at addressing pain as well as soft tissue dysfunction, whether it's a nerve issue or a knee pain issue, respectively. The really cool part is this exists outside of the system of using corticosteroids. I think most people, particularly athletes and those that use or want to improve their performance, understand that corticosteroids, they're bad for you, right? They're okay when used acutely and when used for like, hey, I was out this weekend, I fell on my knee, it's big, blown up and swollen, I need to do something about that. Okay, cool. We'll pull the fluid off of it. We'll inject some steroids, maybe calm it down. Honestly, of all the injections that I do, I maybe do like 2 or 3 of those a year. That's it. Really, I don't see a lot of those and don't use it in that way a lot. Steroids themselves are chondrotoxic. They end up accumulating in soft tissues. They can actually crystallize, and some of them are worse about that than others. And you'll even see, like, historically, when we would go in to do surgery on somebody after they'd had injections, you could see the crystalline structures of the steroids, which is, it's kind of unsettling. It's part of what it does, but you don't want that in your soft tissues. When you want a joint to move and the ligaments to move freely, you don't want crystals. That's bad, right? Crystals are sharp, they hurt, they're not needed. So I don't use them. I don't use steroids a lot of the times. And the benefits of that are that prolotherapy has this idea that it actually supports tissue. So it's really more in the realm of regenerative medicine. So historical prolotherapy is used to actually incite neovascularization and inflammatory response that happens at the tissue. So let's say somebody has a torn ligament. They hurt their knee skiing, or they hurt their shoulder, and they've got a rotator cuff problem. If they're having difficulty repairing that, and particularly if they have pain along with it too, prolotherapy can be used to help the pain, and they can help to induce healing of that structure. It kind of falls in the line of, when you think about like PRP and stem cells, it's kind of in that same world. It's very impactful. It's safe. Like I said, you're not going to build up detrimental intolerances to it. There's no medications outside of, I use an anesthetic and dextrose. So dextrose is a thing that's been around for forever. It's safe. It's the IV version. There's different concentrations depending on what you're going after, from 5% up to potentially 25. 25 is pretty uncomfortable. That's more like doing PRP, but very good at causing tissue restructuring and ultimately growth back of those tissues. 5% is very good for pain suppression. It actually works on a certain receptor in the nerve. It's not a pain blocker. Like anesthetics work by blocking a receptor on the nerve. The prolotherapy, or the dextrose in this case, caused that nerve receptor to leave. It's not available for activation anymore. Therefore, you're not going to have as much pain. So really, huge applications, broad applications. It's safe. I can use it in diabetics all the way down to somebody who's a D1 level athlete. Kind of doesn't matter. Bodybuilders, whatever. Those people who are very concerned about what goes in their body, this is safe for them. There's no issues with that. Again, there's not going to be any medication accumulation. And it can be safely done, and it's reproducible too. That's the nice part.